Hey everyone, welcome back to all my listeners. This is episode 16 in season 17. Today is Wednesday, May 20th, 2026. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, well, welcome back to another episode drop. Today, I really wanted to focus the episode on telehealth modifiers. I think it's been a minute since I've talked about telehealth, right? I know I really came in strong in the new year talking about telehealth. I had developed a telehealth playbook with my very good friend Keisha Wilson. We are talking about providing yet another series of webinars in the days, weeks, and months ahead, because today's episode is going to focus on things that I continue to see as I audit day in and day out for quality, as well as for my multiple providers who render telehealth services. So I continue to see errors as I audit telehealth claims. So for this episode, I wanted to specifically try my best and talk about modifiers in a very quick episode. Let's get into it. So first of all, why don't we start with the biggest payer of all, right? And that is the Centers for Medicare and Medicaid Services. That's our CMS. Now, they've put out a MLN booklet for telehealth and remote monitoring. And of course, they make updates to this booklet from time to time. And the latest iteration talks about telehealth requirements. So I just want to read to you some of it. And it really is a trusted resource that I utilize all the time when it comes to my auditing and my compliance guidance that I provide to my practitioners. So first of all, this booklet talks about telehealth requirements, and they highlight the fact of technology. This is a must. Again, so many things that I see wrong, things go sideways, things are not documented for technology. CMS says, quote, "You must use two-way interactive audio-video technology that allows for communication between the patient and the distant site provider. As of January 1st, 2025, you may also use two-way interactive audio-only technology if the distant site provider is technically capable of using an audio-video telehealth system and the patient is in their home but is not capable of or does not consent to using video technology." So that is a big nuance in the landscape for 2026 when it comes to Medicare versus our commercial payers. So again, as of January 1st, 2025, Medicare will take two-way interactive audio-only technologies, right? They never used to. They had that handful of CPT codes in years prior that were for audio-only technology, but there was never a reimbursement attached to those codes. They had an indicator on those handfuls of codes that disallowed payment on audio-only types of technology. But as of 2025, Medicare will make payments on technology that is for audio-only services. However, again, the caveat, the fine print, is always in the details, right? And the details by the CMS state that the provider has to be technically capable of using audio-video telehealth system, and the patient is in their home, but the patient is not capable of or does not consent to using video technology. So again, that is a deficiency I see in documentation when it comes to Medicare claims that I am auditing. So I wanted to make sure that the audience knows that. Now, the CMS MLN booklet continues and talks about for behavioral or mental telehealth, you may use two-way interactive audio-only technology and the patient must be in their home. Now, the booklet goes on and talks about telehealth billing and payment. And it says, quote, "If you performed telehealth through asynchronous telehealth, add the telehealth GQ modifier with the professional service CPT or HCPCS code. You are certifying that you collected and sent the asynchronous medical file at the distant site from a federal telemedicine demonstration conducted in the state of Alaska or Hawaii. So that's very, very specific to those two states alone for the modifier GQ. So keep that in mind as you are auditing. It is not to be used for any other state. Moving on, the booklet talks about distant site practitioners billing telehealth under the CA, or Critical Access Hospital, optional payment method number 2, must submit institutional claims using the GT modifier. So in that particular instance, only is the GT modifier allowable. Because remember, back on January 1st of 2018, the GT modifier was discontinued from all other uses for telehealth types of services. All right, so moving on, we can talk about the MLN booklet discussing institutional billing. And it says, quote, use modifier 95 for outpatient therapy services provided via telehealth by qualified physical therapists, occupational therapists, or speech language pathologists employed by hospitals. So again, specifically in the booklet, they are talking about institutional billing and utilizing the modifier 95 for those specific outpatient therapy services. So that has not changed in 2026. So make sure you keep that in mind as you are looking over claims and coordinating documentation. The booklet goes on and talks about professional billing. Quote, as of January 1st, 2024, use the place of service 02, which is defined as telehealth provided other than in a patient's home. It's the location where you provide health services and health-related services through telecommunication technology. The patient is not located in their home when receiving health services or health-related services through telecommunication technology. Then there's also a place of service 10, which is defined as telehealth provided in the patient's home. Now, this is the location where you provide health services and health-related services through telecommunication technology. The patient is in their home, which is a location other than a hospital or other facility where the patient gets care in a private residence when receiving health services or health-related services through telecommunication technology. Now, Medicare also recognizes audio only, right, which I just talked about earlier. Interactive telecommunication systems may permanently include two-way, real-time audio-only communication technology for any telehealth service furnished to a patient in their home if the distant site physician or practitioner is technically capable of using an interactive telecommunication system, but the patient is not capable of or does not consent to the use of video technology. You are required to use the following modifiers when billing for these services. CMS highlights CPT modifier 93 and or the Medicare modifier FQ, which is also to be used by the federally qualified health centers and rural health clinics. So keep that in mind as well as you are auditing, because I continue to see so many deficiencies and so many confusions. And I completely understand this because we've gone through so many ups and downs, so many waivers that were continued and then the waivers were discontinued, et cetera, right? So since the pandemic, things were up and down. After the pandemic ended, things were up and down. After the government shutdowns, things were up and down, right? We have been through periods of flux for a number of years when it comes to our telehealth services. So it's no wonder that it's 2026 and I continue to see documentation that is deficient, documentation that is not meeting the standards of the various payers that I audit. And specifically, just a moment ago, I was only highlighting the CMS, right? And what does Medicare expect? Medicaid is very different as well from state to state. So you really have to dig in your heels and do the research from statute to statute, from the regulations to regulations between the 50 states. They are all different. And if you are lucky enough to attend one of my telehealth webinars, I go into much, much greater detail when it comes to compliant billing standards, when it comes to billed claims, as well as that coordinating documentation. So there's so much to unpack, but for this episode, I specifically just wanted to go over a lot of the confusion that arises with the differences in these modifiers. And again, things have been changing from month to month over the years, so you're not alone. You are not alone. Now, what do other payers have to say about telehealth modifiers, right? They specifically talk about the modifiers 93, again, for the synchronous telemedicine service rendered via telephone or other real-time interactive audio-only telecommunication systems. They also talk about the modifier 95, which is defined as synchronous telemedicine service rendered via a real-time interactive audio and video telecommunication system. Now, we can move on. There's also the modifiers FQ that the other payers use, which is for the telehealth service was furnished using real-time audio-only communication technology. Again, some payers want it used for the FQHC. Some payers prefer it for the behavioral health types of services. So you really have to dig in to those payer policies. They also want to use the modifier FR, which is for a supervising practitioner was present through a real-time two-way audio-video communication technology. Other payers also talk about the modifier GO, which is used to identify telehealth services furnished for purposes of diagnosis, evaluation, or treatment of symptoms of an acute stroke. And many payers still use that as well. So you really have to pay attention. And then finally, that modifier GQ, certain commercial payers do recognize it as well. And that is defined as our asynchronous telehealth service. It's not used, again, unless you are in Alaska or Hawaii. Now, let me just pull out a couple of policies that I know like the back of my hand. There is Blue Cross Blue Shield of Illinois, and they specifically have a telehealth policy over the years. And the one I'm looking at currently talks about key billing requirements. And they talk about their place of service, their POS codes that they prefer to see, right? They want to see the place of service 10, which is used for services provided in the patient's home. And they also prefer place of service 02, which is again used for services provided outside of the patient's home. For example, a clinic. They also list modifiers. Append the correct modifier to the CPT or HCPCS code. And they prefer the modifiers FQ, FR, GO, GT, 93, 95, and others are used to identify the service type. Modifier 95 is used for audio-visual telehealth, and modifier 93 is used for audio-only visits with specific requirements depending on the payer. So there you go. They define them differently, and they also talk about many of the other specifics for the various blue plans, right? It goes on and says, check the specific policy details to determine the correct modifier for your service. So again, is it a telehealth acceptable service, right? So you have to understand the various CPT codes, the various specialties. Is telehealth allowed? So what modifier can you use? Then they go on and talk about codes. Use the new evaluation and management E&M telehealth codes, which were effective January 1st, 2025. So they're also very, very different than the CMS, right? The CMS only prefers the more traditional office and other outpatient E&M codes to be used for their telehealth versus the new 98,000 series of CPT codes, right? But Blue Cross Blue Shield of Illinois here specifically states that they prefer those newer 98,000 series of codes. So there's so much nuance and detail in these payer policies that someone on your teams has to really know and understand the various payers in your payer matrix, because they're all going to be different. I guarantee it, because I am auditing claims left, right, and center from all of the commercial payers, and their policies stray from CMS significantly. So it's important that you stay abreast of what is going on with the various payers in your payer matrix. And then finally, let me just quickly talk about Cigna. I just happened to pull them. They also have a telehealth policy, and their general requirements state telehealth services must be provided by a licensed healthcare professional in the United States. Services must be performed using audio, video, or audio-only technology. Patients must be located in a place that is eligible for telehealth services under Medicare regulations. Billing codes. They go over, use the same evaluation and management E&M codes as for in-person visits. So they are siding with the Medicare, right, which they just spoke about a second ago in their policy. So they would prefer the office and other outpatient codes, right, for in-person visits, which is our CPT codes 99202 through 99215. They go on and state append the modifier 95 for audio video services, append the modifier 93 for audio only services, use place of service 02 for telehealth services performed in a non-physician's office setting, such as a patient's home. So they're saying to use 02 for the patient's home. And then they also go on and say use place of service 10 for telehealth services performed in a physician's office. So they state things differently than CMS. So in general, between Medicare and the commercials, right, it seems to me, as I've been analyzing telehealth claims for years, although Medicare currently emphasizes their place of service codes to process virtual claims, many commercial insurance providers still actively require the modifier 95 to trigger the correct telehealth reimbursement. So the Medicare will use their place of service to render and push reimbursement, right? Whereas the modifier is more important on the commercial end. Now, place of service codes, when billing our telehealth claims, it's important, right, to understand that the place of service codes affect reimbursement for Medicare. Place of service 02 refers to telehealth provided other than in the patient's home, and place of service 10 refers to telehealth provided in the patient's home. Now, there are many common telehealth billing mistakes, which definitely include the modifiers, but also the billing codes, right? There are more than 250 telehealth services that are covered under Medicare. Using the wrong code can delay your reimbursement. This can happen for a variety of reasons, such as a misunderstanding of what the code applies to, what service, or the input error, right? So there's many mistakes that could happen, either a misunderstanding or you simply had a fat finger and you made a typo as you are typing in those 5 keystrokes, right? So you've got to stay up to date on the list of telehealth services to keep your practice running smoothly. Now, another common mistake includes modality. This also I see missing and insufficient as I audit. It's important to make sure that you're using an allowable and HIPAA compliant modality. I'm going to be talking about HIPAA compliance in a webinar I'm doing for Healthcare Inspired LLC next Thursday. So please attend if you can, because I'm going to go deep in the weeds and talk about HIPAA compliance when it comes to our telehealth platforms. And that involves modality, right? So that modality has to be allowable and HIPAA compliant today in 2026. So you got to make sure. And then if you're using a modifier, it's got to be the one that matches that modality, right? And then of course, location, that's also still a big confusion item, which I just highlighted, right? The various payers talk about place of service 02 and 10 in different ways. Some payers also, which I didn't talk about here, but I will right now, some payers still expect the place of service to be as if you were in the office. So there are still certain payers that do that as well. So if it is a telehealth claim, you can still use place of service 11 as if you were actually in the office, right? But then it's that modifier that is going to trigger the reimbursement for the telehealth service. So again, it's really nuanced, fine, rich detail between all of the commercial payers. So you really have to understand and identify each payer as you are coding claims and sending them out the door, because you cannot do a cookie cutter, one size fits all type of a program at your practice, unless of course you happen to only carry one particular payer, right? That will only work if you only carry one insurance carrier. But I understand that many practices are much more nuanced and they do accept a variety of our insurance payers. So make sure that you are compliant and someone on your team is aware of the multiple reimbursement policies, the multiple documentation standards that are required. So that brings me up to documentation. Post-visit documentation must be as thorough as possible to ensure prompt reimbursement, right? And I just see this as sorely lacking, even in Q2. As we're wrapping up Q2 here in 2026, I still see so much that could be improved. So I really, really hope that you guys got a lot out of this very short and quick episode on telehealth modifiers. Yes, I did touch a lot more on place of service as well. And I did talk about a couple of the commercials, but I really do hope that this episode is going to go a long way in terms of how to identify and quickly rectify the billing mistakes that can happen if you do not know off the top of your head what is going on currently as of May 2026 with telehealth for your particular payer. So I really hope you guys got a lot out of this. I know I am doing a lot of work on it, creating a lot of education for it still. I don't think my education is going to stop on this anytime soon, simply because it's all over the news, right? The OIG is looking at telehealth. There are various TPEs, those are targeted probe and educate audits that are going on for telehealth. So there is much more vigilance and scrutiny that our payers are paying close attention to. So that is our job as educators to make sure that our organizations, entities, and providers are equipped with the most current information. So I hope this audience got a lot out of this episode today. I really loved delivering it. I'm very passionate about telehealth and making sure that my practitioners are developing compliance programs that embrace telehealth and telemedicine at their practices. All right, you guys. Well, I wish you all a very, very happy long weekend. Hope you take the time to enjoy it. Relish in some quiet time as well whenever you get the chance over the weekend. So thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.